the ball game as it relates to Medicare, and I know the President and the Senate has spent a lot of time on these budget issues, is all about chronic disease. That's where the Medicare dollar goes. It goes into the treatment of heart and stroke and diabetes. That's where the money really goes. And millions of those who suffer from these devastating, illnesses are those folks that I'm speaking about, the dual eligibles, people who are eligible for both Medicare and Medicaid. And millions of them are eligible for alternative services, particularly services at home. But right now, a disproportionately large number of them get their care in the most expensive kind of setting, a place where they don't want to be, the hospital and the hospital emergency room. And the fact of the matter is, all over the country, in the state of Ohio, in the state of Missouri, every single day, these folks are going in ambulances to hospital emergency rooms. Often they end up having to go life flight, essentially, in the air to these facilities. And as of today, even though we've got more than 9 million of these individuals who are on both Medicare and Medicaid, according to Dr. Don Berwick at the Center of Medicare and Medicaid Services, only about 100,000 of them are being taken care of at home. So, of course, the Congress worked on the health reform issue, and it was possible in that legislation to move to take a few thousand more than the 100,000 that are now being taken. But as Chairman Baucus highlighted just a few days ago, we ought to get serious about this and do a lot more, because older people, if we come up with approaches that allows them to get cared for at home, will feel better about our health care system and better about the decisions that are being made around here, and taxpayers are going to save money. Here's something that works. We know it works. It was proven by Chairman Baucus's recent hearing. We now know, based on the VA's important new study with respect to how you can care for older people at home, that we have an opportunity to significantly expand care for older people at home in this country and generate significant budget savings. It will be bipartisan. It's something that ought to be picked up by the super committee. It ought to be picked up by both the full Senate and the full House, and we need to do it now. If we don't do it now, if this is put off yet again after Chairman Baucus's important hearing has once again opened the door to major reform, as sure as the night follows the day, Congresses 5-10 years from now will be debating exactly the same thing. I don't think that's right. Holding down health care costs does not have to mean benefit cuts or cuts to reimbursement. We've got a chance with this Independence at Home program to secure for older people more of the care they need in the comfort of their own home, and providers are actually rewarded with shared savings for delivering the kind of quality care that they have always wanted to provide.